on to health news. Cancer has been called the silent killer, and the sheer potency of the ailment has been the preoccupation of global health authorities for decades. According to World Health Organization, cancer is the second leading cause of death globally, accounting for more than an estimated 10 million deaths, or 1 in 6 deaths annually. In middle-level countries such as Nigeria, awareness of cancer-causing elements is still very low, but has also been picking up over the last few years. Public response to efforts at enlightenment has also been on a steady upward curve. Now, joining us now to have a chat around this, as well as the importance of adhering to basic prompts on care of other parts of the human body, is Dr. Chinenye Iwuji, who is Head Clinical Oncology at Lakeshore Cancer Center here in Lagos. Good afternoon. Welcome to Newsday. Thank you so much for joining us on the program.
Good afternoon. Good afternoon. It's a pleasure to be here.
Now, first of all, let's start with how prevalent cancer is in Nigeria. Is there any particular gender, or should I say age range, that is more affected than the other?
Well, cancer is actually a lot more prevalent in Nigeria than we would think. Previously, we were focusing on illnesses like malaria, HIV, tuberculosis, but what we know now is that cancer is actually killing more people than all of those illnesses combined. Now, what we find is in Nigeria, actually, the prevalence and the age range that's affected is lower than in Western countries. So cancers that would affect people in their 70s or 80s in those countries are affecting Nigerians in their 40s or 50s. And that's across both males and females. So it's something that we really need to get a grip on.
So what's causing that?
There's a number of different factors. First of all, awareness is a big issue. Having screening programs so that we can actually detect the cancers at earlier ages. Our diet has radically changed over the past, I would say, 30, 40, 50 years. And as we go into a more Western diet with more fast food and we get more sedentary in our lifestyle, we're not exercising as much, all of those things are risk factors, let alone when we get to things like pollution and the use of plastics and the stress that we go through in our day-to-day lives. All of these things are risk factors that we really underestimate. So it's important that we start addressing them more.
So beyond awareness campaigns, what role do you believe healthcare professionals and policymakers, those in the government, play in addressing this growing burden of cancer in Nigeria? What initiatives or should in promoting early detection and intervention should be pushed further when speaking about this?
Okay, so first and foremost, we really need to focus on education and screening. So that's education not just for the general public, but also for healthcare professionals as well. So we have, for example, programs like Foundation for Cancer Care that brings education into secondary school so that even children will know this is something that they should be looking out for, and they follow that into adulthood. We need to take away the stigma of cancer. People need to talk about it a lot more. Everybody thinks cancer is a death sentence, but there are actually people who have survived cancer, but they don't want to talk about it because they don't want to be labeled with that illness. In terms of policy, we need to push screening programs, national screening programs. We need to improve the infrastructure we have to provide cancer care to patients, because cancer is really a very, very expensive illness. And for people to be paying for cancer drugs, cancer surgery out of pocket is a huge, huge blow to them. Actually, a lot of our patients struggle with financial toxicity, trying to deal with these immense costs for treating cancer. So there's so many levels that we can go to on this in terms of how we can address this problem.
Well, definitely. And I'm wondering, what you do at Lakeshore Cancer Center. Of course, I know, you deal with cancer issues and all, but do you have, ways in which maybe you assist people that have issues with finances or something? I understand you're even having a health fair today. Can you just tell us a bit more about that?
Yes, okay. So at Lakeshore, we have the Foundation for Cancer Care. Actually, Foundation for Cancer Care started before Lakeshore, and Lakeshore was birthed through that. And what we do at the foundation is we provide sort of facilitate education, screening, prevention, and right through to treatment. And at the foundation, we also help fund radiotherapy treatment for indigent patients who are not able to afford that treatment. So we give free screenings, and at the health fair today, it'll be free screenings from multiple different health care providers. It's not just Lakeshore. So you'll be able to get dental checks, eye checks, cancer screening checks, check your blood pressure, and all of that is for free. And those are exactly the sort of lifestyle changes and lifestyle initiatives that we need to be doing more and more so that people can be aware of what their risk factors might be. So.
I mean, I'm curious. You've spoken about the need to educate people and the fact that there is some kind of stigma that is associated with cancer. But in your experience, what are some of the most common misconceptions or myths surrounding cancer prevention and detection? And how can these misconceptions be effectively debunked so that people are actually empowered with the knowledge that they need to be able to, face this in case they find themselves in this kind of situation?
Okay, that's a very good question. I mean, first and foremost, we need to understand that cancer can be treated, and it can be treated here in Nigeria. Okay, so that's the big problem. People get cancer, of course, it's a very scary diagnosis. They feel they need to immediately fly out of the country, whereas we do have very good facilities here in Nigeria that can deal with cancer. Secondly, people worry about chemotherapy. As soon as they hear chemotherapy, sometimes they think chemotherapy is more deadly than the cancer itself. Whereas I specialize purely in giving chemotherapy, and I know that we have seen a lot of success stories. And it's a situation where we have to manage the patient, not just the illness. So if you're giving the treatment in a responsible way, then you can actually get very, very good outcomes. And people need to be aware of things like examining themselves. So ladies need to do their breast exams, men need to go for their PSA checks, everybody needs to go for their colonoscopies and colorectal screening, so that if we catch the cancer early, cancer can be cured. So those are some of the things that I really think need to be pushed out and people need to be more aware of.
And then, of course, we've had cases, of people surgically removing body parts because it's been determined that they have the cancer gene. I could name a number of celebrities, that have done that. Do you recommend this? How well does that work, in preventing cancer?
Okay, so that is more a scenario where you have, for example, a family history of cancer. Or if you get a young lady who has a breast cancer, if a lady is getting breast cancer in her 30s or 40s, or if you have male breast cancer, which is a thing, 1 in 100 breast cancers occur in males, that starts ringing alarm bells or sending up red flags that this might be a genetic problem. So you should then get genetic screening. Again, we have genetic screening in Nigeria. It's just a blood test. So if we can get that blood test done and it does show that you carry the gene for cancer, then some ladies do go ahead and have a preventative mastectomy. So instead of just taking off the breast that's affected, they can take off both breasts. Sometimes they go ahead and have a hysterectomy as well, as a means of reducing the risk of getting the cancer in the future. So not all ladies do it. It's not essential. If you don't choose to do that, you can just get screened a lot more vigorously. But some ladies don't even want to go near that risk.
But you talked about it reducing the risk. So that means even after the removal, it's not foolproof that the person will not get cancer.
That is true. It's not foolproof. So what we do when we're treating cancers, and it's important for people to understand and taper their expectations. When we are treating cancer, even when we're curatively treating cancer, there is still a risk of the cancer coming back in the future. So that's why we need to monitor patients very closely. And this is another misconception. People have a cancer, they get treated, it's cured, fantastic, and then they don't continue with their follow-up. They go and give their testimonies in church, which is appropriate, but we still need to continue with the follow-up so that if anything happens again in the future, God forbid, we can catch it at an early stage so we can stay on the curative path. And I think that's very important for people to know.
Yes, I mean, this is a fantastic, fair that you've put together, and I'm wondering if you have any external support. Are you getting any support from the government, from whether it be it local, be it state, be it federal, and also looking ahead, how do you envision the future of cancer and prevention, cancer prevention in Nigeria? Yes, those are my two questions.
Okay, if I forget one, then make sure you come back and remind me. Okay, so starting with the first one. So the health fair is being held at Landmark Beach. Yes. So that in itself is supportive because obviously they're opening up for people to come to their beach so that they can have, we can have this health fair and get the health checks done. So that's one area of support. And cancer care needs a lot of collaboration. Okay, so the reason why we are joining up with all these different health centers is because, you might have your chemotherapy at Lakeshore, but you might have your radiotherapy at NSI at Luth. You might have your surgery at another center altogether. So all these different healthcare providers are coming together, and we are supporting each other in the fight against cancer. As far as I'm aware, I don't think we had any government support or sponsorship. I could be wrong, but as far as I'm aware, this is something that has been put together by the different healthcare facilities. And then you were asking about prevention of cancer in the future.
Yes.
So prevention is definitely better than cure. And there are a lot of lifestyle changes that we need to be aware of. Everybody thinks of smoking and cancer. True, smoking is a big risk factor for cancer. But being overweight and not exercising are also very big risk factors. In fact, there are some cancers, such as colorectal cancer, which is now one of the top 3 cancers in Nigeria. For colorectal cancer, being overweight, being obese, drinking excess alcohol, all of these things are actually higher risk factors than smoking for this particular cancer. So if we try and just have a look at our lifestyles, just be a bit more healthy, those are the things that can help prevent cancer from occurring.
Well, and just before I let you go, I'd like you to talk to us a bit about childhood cancer. It seems we're having, rising cases of such, here in Nigeria. What could be responsible for it? What can be done, to prevent such? Is it possible to prevent it?
It can. I mean, childhood cancer is something that is very heartbreaking, and I think we all agree should not happen to any child or any parent. And the fact that it is rising is a problem. Having said that, I know that at Luth they have a pediatric unit that does deal pediatric oncology unit that does deal with these childhood cancers, and we are getting more and more aware of it in our environment. In terms of preventing it, I think we need to look at the genetics. We need to do a lot more research as to why we're being affected that way, and research is something that really needs to grow in Nigeria right now for us to get to the bottom of why our population is seeing these cases more and more.
Finally, tell us a bit more about the fair so that Nigerians can be aware before we let you go.
Okay, so this is a health fair that's being held at Landmark Beach today. There are all sorts of checks being done. You can
From what time?
It started at 10 o'clock, but it will continue until 5 p.m. this evening, so it's not too late if people are seeing this just now. The health check is completely free. And we'll be doing all sorts of checks, eye checks, dental checks, cancer screening, advice about fertility, blood pressure, glucose checks, the full range. And so it's all free, and it's at Landmark Beach right now. And it's being sponsored by 18 different healthcare providers will be there. So it's a great opportunity.
Fantastic. Thank you so much, Dr. Chinenye Iwuji,
you.
Head Clinical Oncology at the Lakeshore Cancer Center. We appreciate your time and, of course, analysis here on Newsday.